Let's kick off. So welcome everybody. We are here for the ASE webinar for NFPs and charities to help you use your data like a superstar and how to use your data better. We've got an awesome lineup of panelists with over a decade experience working in this industry. We've got some stellar questions lined up. If you have further questions, please feel free to type them in the little chat box and we'll try and get to those at the end if we can get through the ones that we have already. So we know that data can be really hard. It can be challenging. We understand that you're time poor. And what we want to do is help you understand where your data is, why your data is important, and why you should care, and then what you should do with it. And hopefully through these things will help you to, I guess, make a list of the opportunities that you can create with your data so that you can put those forward to potentially your board, to the government for funding opportunities, for grants and things like that. So we'll start off and we'll just go around. We'll start with you, Trevor. Who are you? What do you do? And why is...
Good morning. It's still morning. Yes, good morning, everybody. Trevor Weeding. My business is Development Pathways. It's a relatively new business, but I work with the small end of the small business spectrum, helping them make the right decisions around things like staffing and so on, but also to help them with their marketing and their community engagement, which is a passion of mine as well. I've had a 35-year career in advertising sales and newspaper management, mostly in the community newspaper industry. And in those days, the community used to come knocking on my door wanting support and sponsorship, and I now try and help small businesses to involve themselves in their local community and make the best decision they can about what to support and how to support it in their areas.
Awesome. Righto, Pat, do you want to tell us who you are, what do you do, and why is data important to your clients?
Yes, my name is Pat Gross, the community entrepreneur, and we work with the not-for-profit sector and translating the vision into the results. And one of the ways that we do that is through helping the clients to access grants. And it's very important to get the data to build a business case for the application. Not just to get over the line, but to really stand out, because that's what's lacking in the space. People want the funders want some more data. Also, with I'm finding at the moment is that it's important to clients who want to remain financially viable, and how that data is collected inside the organisation as well. And also it starts with your strategic plan. Because if you're not actually collecting the data, what's going on out in the world, in your own world, your plan's not going to make sense anyway.
Yeah, definitely need that alignment there, don't we? Annie, over to you.
Well, hello, everybody. Lovely to be joining you today. I'm Annie Gibbons, the CEO of Glaucoma Australia, which is an eye health charity. And as a CEO of a charity, and I'm also an owner of a college, an optical training college, and a business and life coaching business. So I sort of look at data with three different hats on, which is always really great. And that's what you'll find in this webinar today, that we've got very different perspectives on how we actually use our data and why it is meaningful to us. I suppose as a CEO, I'm always looking at security of data, storage of data, the integrity of that data, and then its ability to be able to communicate via reports. And so because I'm all into the message, I love the digital storytelling aspect of data. So as a CEO, I want to know on every level of my business, well, what is that data actually telling me? What's my return of investment on different campaigns that we're having, what the staff are contributing to, so that we can actually make it relevant to us, so I can adapt quickly as opposed to wait to the end of something and then hopefully the results will speak for themselves. So I'm looking forward to our conversation today.
Awesome. Thank you, Annie. And finally, Christoph.
Hi, everyone. So Christoph from ASE, part of the solutions team that look after it. So what's relevant for us is decoupling of data. And I think to the point that everyone's made, Trevor, Patricia and Annie, they're all different. So what we try to understand is, how does that data look? Where does it look? where does it live, and then decoupling that to allow that to abstract it and bring some real business value out of it. In regards to Annie was saying, you know, it's being able to report, in regards to what Trevor was saying, is being able to use that so that you can actually connect and, you know, engage with your community. And for Patricia, it's being able to, you know, benchmark and use that data so that you can get those grants that are out there, so that a charity can focus on you know, serving the community and the not-for-profit that they're achieving, as opposed to worrying about what the data is that they're trying to manage.
Cool. And perhaps we can go into some of those terms that you use in a bit more detail later on, like decoupling, for those that potentially aren't as familiar. So we're going to kick off with a question for Pat and Christoph, but anyone free to jump in. Can you give us examples of good data collection? And what data should charities be collecting and how?
Okay, I'm going to give you an example, and I'm going into the grant space here, but I also want to go into the evaluation space. What if you were to apply for a grant for a certain amount of money and ended up getting 60% more than you applied for?
Wow, tell us more.
I'm hooked.
One of our clients did that. And quite simply, it was because of the strength of the information in the business case, and it was backed up by data. The collection of information, it was a partnership of two, but they were both able to bring to the table enough data to justify the need and build that big case for the funding to go to them, but also and their capability of being able to manage the project as well, of their successes, and they were able to quantify that with data. And now I'm going to go to the other side and go that one of the ways of collecting data in the program space is through evaluation process. And again, I've got a client who's continually sort of getting project after project, because they've managed to collect a lot of data that's proved the success of their previous projects. And I say to people, oh, tell me about a really successful project you did. And they'll tell us about it, and they're full of enthusiasm. And I'll say to them, prove it. And they can't, because they don't have the data. So they've missed an opportunity to lobby, to go to the next stage, to apply for funding. There's lots of things you can do with that data, not just present it in a report at the end of the term to go to somebody else. But I've got to tell you a story of a new organization, newly incorporated, first time out for a grant. And I said to them, you need to prove that you've got this audience. So these people, it was a multicultural grant, multicultural youth. I said, you would need to get some real good data to back up why it should be you. They went out in a space of 10 days with a series of consistent questions, and they interviewed 267 of those people, and they went everywhere to find them, not just in one space. And their first time out, they not only got funded, but they got one of those presentation checks from the minister.
That's pretty.
There you go.
Very cool.
Excellent. And that brings to that point, I think, Rachel, when we were talking about just before around how important it is to know where to look for the data as well. So you can actually, you'll always find that there is data within a business. It's just maybe hidden somewhere in a platform or in a spreadsheet. I think, Trevor, you'd probably have experience with this, where people have a lot of the information, it's just hidden.
Yeah, as we said earlier when we were setting up the meeting, that Excel spreadsheets are definitely a thing of the past. Even though for some people they're still the latest things in sliced bread, I guess. I was going to tip in as well that there's data sitting outside that can be brought into a business. And the example I'm thinking of is a not-for-profit that owned their own building and pre-COVID used to rent the hall out as a revenue source. And it's big enough to hold a couple of hundred people for a function of some sort. Think of the old-fashioned community hall for like a dance hall or something of that nature. And they're looking at what are they going to do when COVID is completely gone and they can have crowds in and not have to worry about shutdowns at a moment's notice and all that sort of thing. The starting point of my conversation with them was, well, you are all 55, 60 plus, and you all remember this region of Sydney for what it was when you all grew up. Let's have a look at the latest data around just the population statistics that are coming in from the ABS. And guess what? There were these ethnic groups that they hadn't even thought of that were clearly growing, and we're waiting for the next census, and I'm sure the trend's going to continue. And all of a sudden now they're targeting people from other ethnic backgrounds who are known to have big family gatherings, big social events in that sort of space. They'd never even considered using that. So it's not just data they collect in the organisation, it's matching what's out there with their own information as well.
So poignant you say that, Trevor, because as you said, data lives in various, various and different sources. It could be anything from, as you said, the census data. It could be transport data, weather data that could make a difference, right?
Absolutely.
We have different rulings too on patient data because it's a health charity. So patients who are referred to us obviously are giving us personal information. And so we also have to link that to confidentiality policies and statements of how their data is used and stored, and what if we do research on that data, how that would be used, and is it de-identified. So there's a real sensitivity point there, but there's also a legal responsibility with that data. I suppose also I break data into, if you, in an easy way, is internal and external to my organisation. From an operational perspective, I look at, I'm a change management CEO, so I often come into charities or not-for-profits who've got data that's replicated everywhere. That's right, as Trevor was saying, it's on, say a stakeholder spreadsheet. Someone's got one, the next staff member, 6 staff members could have their own, which is developed over years. It's their little black book, right? So actually getting that into a CRM and being able to get consistency of data and everyone in that same, out of their silos and into a team approach, an open visibility approach. I think that's a huge transition for particularly older workers who've worked in a certain way. So I think that is great. One, pulling as much into one core source, which is a CRM. The other bit is also then you've got data on the flows, the operational manuals. How does our team actually work? If someone wasn't here, went on leave, was replaced, how is that data communicated and also stored and used, rather than, the old view of you write a beautiful policy and then it gets stuck somewhere and no one actually revisits it. So how does it actually become operational? And particularly, it's also got a link from an external point of view. Our job, we've got key targets, and that should influence our data. And so, for example, we've got a KPI to have 300 patient referrals a month at the moment. And so therefore I need to go, okay, well, how am I measuring those 300 referrals? What is the source that they're coming from? They might come from 5 different channels, a doctor, of the website, whatever. I need to actually have visibility on that data because I want to know what's working and what's not, right? There's no point being an eye health charity and thinking 90% would be coming from the doctors when actually they're coming from a pharmacist, or they're coming from, a different campaign, from one of our ambassadors. Kirk Pengilly might have done that, and they're coming via his message. So that will help me improve the quality of my service delivery because of the analytics of that data. So it's really quite, I love this topic.
And that speaks to, Annie, to what Pat said earlier about having your data linked to your business strategy, because there's no point having all this data if we don't use it meaningfully, right?
Oh, so true, Rachel. Like we actually had that problem that when we first started a new referral pathway, we asked for too much data, which is amazing, right? You think, can you have too much? Well, yes, you can, because if it wasn't necessary for our KPIs, we were going too broad. We needed to get more focused. Also, the more you ask a client or a customer, the more threatened they get with data. So it was actually, by the time you've asked them 10 questions, you've kept them on the phone too long, they're not feeling as confident. Whereas if you just ask them for 3, and then build that data over time, establish that customer journey after they've had 3 touch points, 5 touch points. They'll give us pretty much after a year, they'll tell us anything we need to know. But it's the time of data as well.
Brilliant. So I think part of that conversation is very important that you said, Annie, and that's also around the governance, right? So it's that concept of knowing where and how you're keeping that data so it's safe and secure at the same time.
Oh, absolutely. I mean, for example, I've just brought on 2 brand new board members. So that's just a process in any charity, not-for-profit business. And then so as soon as they're given access, they're to our server. So we're on Office 365, for example. So one, even the point of, do you give them a company email or do they use their own email? There's a potential security breach there. You know, so starting them up with, you know, their access levels. How is that? You know, what do they have access to and not? How do they access different parts of the organization? What levels of folders? If they're then on a board and they're responsible for me being their CEO and communicating data, I'll get asked for data from different companies on specific things. How is that data then communicated? So even from a high level, it is extremely important that I have confidence for my directors, and I'm also a director on other businesses, that your data is safe and secure. You know, for example, many people, if I had asked you listening in, do you even know where your data is stored? Where is it housed? You know, when I came to this organization, it was like the answer was somewhere in Melbourne. What does that mean, right? You know, if I needed to access that data, where is it? What is their security? If I actually needed it, not just to access it, but how would it then become usable for me to import? You know, if the place went down during COVID, you know, how would I find that and then be able to carry on my business? So there's so many factors that we need to look at, and governance is where it all starts.
No, totally.
Annie, could I just add to that as well? I remember when the Privacy Act came into being, in the business I was running, a business unit, we had a whole lot of data that was now illegal for us to hold. And we couldn't collect it anymore. And the average salesperson was used to keeping something as simple as when their clients' birthdays were, which was no longer legal to have. So yeah, knowing where it is and what's in there, absolutely vital. I agree.
Yeah.
So I think that leads us nicely to the next question, Annie, that is aimed particularly at you. And you've already covered off a little bit of this, but I'm sure you've got some greater insight. But why is data capture important to your role as CEO of Glaucoma Australia?
Data capture is important, building on what I said before, because it gives me a clear picture against my KPIs. So if I've got my strategy and I've got my key KPIs, for example, you know, KPI number 3 for me is sustainability of the organization. So a great example of that would be that we've just sent out a survey to previous donors. I need to know what data do I have there? How often have those people given? What's their average donation and so forth. So when we then surveyed them, and then we then got a response back, a 68% increase in our potential bequest pipeline.
Wow.
That's amazing, right? It's
That's
been
unreal.
incredibly successful. So why was it successful? Because it was targeted because of data. We didn't, instead of going to, you know, 23,000 emails, we actually just sent a personal letter, email communication to the people who are relevant, people who had given before. If you've given once, you're more likely to give more. And then you're also likely, and for those bigger donors, you're more likely to be a potential bequester in the future. And so the conversation, so because of the data and what we were looking at, it was then targeted and appropriate for that person to receive. It also then allowed us to measure that campaign. As they came in, we tracked that data. And so, you know, that's right. How many now of that 68% increase are now in the interested, intended, or confirmed? We had like at least 15, 18 confirmed. Well, that's a huge confidence for our organisation to know that is in the pipeline. It might not be realised for 10 to 15 years, but that is a lot of security. So that's a great example. Another example is on me demonstrating my message. Our KPI number 2 is all about making sure that we make a difference for people that we serve. If we're an eye health charity and we are trying to find the people who are undiagnosed and then also support the people who are diagnosed, it's a very detect and defeat strategy. Well, then those who we are supporting, how are we supporting and what value do we have? A bit like Patricia was saying before, otherwise you could be just busy. We could be on the phone all day talking to people, but how do we measure our impact? And very much I look at that. So I want to know, do we improve people's mental health because they had that call? Do they take their medication more often? Do they go to their appointments more regularly? Do they understand? Do they have a greater knowledge about their disease state? So much so that I would have confidence that I would do a mass study with people out in the community who weren't connected to our organisation, and there would be a difference. There should be a difference. Otherwise, why bother? So you have to
Absolutely.
actually be, as a CEO, you have to be in that position that you go, do I trust the value that I give? And am I happy to demonstrate that with data? Because that's what should lead your annual reports, that you have a certain amount of, evidence of percentage who thrilled with their service, a percentage who are now taking their medications. If I can get people with glaucoma, for example, to be 80% adherent to their medication when the national average is 50, well, that's a phenomenal value, which will then spring onto all those other things, such as getting grants, getting other sponsorship, corporate sponsorship, because we demonstrate our value.
Yes, exactly. And I think, so my next question to you, Annie, was going to be, how do you use that data to communicate an empowering story? But you've really already telling us, like it's amazing. It's communicating that value and people connecting with it.
Yeah, well, it's using that, and then probably the extension of the survey with the donors to become bequesters. Exactly that. Then we then put back to what do we do with those people who responded to that survey? We then send them a communication pack, a bequest pack, which is really personal and tailored to them. And then we also then capture, then we swing into another side of it. So that's service delivery, but then on our database, when do we phone those people? When do we, I want to phone them, I've got, at the moment, we phone them on their birthday. Happy birthday to you, to the bequesters. At Christmas, I'm just going to give you a little trinket to put on your tree as a thank you. You don't always communicate with them just to ask for money, for example. Absolutely. You're building relationships. So that data helps, if I pick any aspect of my business, every single campaign, I'm using the data to drive the quality improvements of the campaign and to get visibility on how it met my KPIs. But I'm also, at the end of the day, linking everything to adding value that I can communicate back really clearly, on just massive stats, stats that are meaningful. Most people glaze over, you give them an Excel or a P&L or anything. It's just like blah, right? And fair enough, because I want to know that, this mom who had a child diagnosed with this disease had this service and she felt this percent thrilled of the service, and that she recommended it to this, and she went back and she told her doctor, because we're all about saving sight and improving people's quality of life. The story around the data is actually what makes you gold as a business, right? It is what other people are attracted to. It's what people will donate towards. It's where they actually, not just that you're prettier and more popular, you actually seriously will add more value, because when you get more support and engagement in your business, whatever it is, you'll be able to then serve more. And that's what we're all about, in this industry, is actually we're heart driven for purpose.
Yeah.
And so we are able to do more. So I have no problem with, I want to use that data to get as much money as I can, to get as much value as I can, because then I can then give back to the people that we serve.
Yeah, and that's completely to Patricia's conversation earlier, right? Is that it's benchmarking, it's showing, it's proving, because you could be serving the community, you're just not able to prove it.
Yes, exactly. And then you can come back. If someone asks me something, like say I'm on a radio interview and they'll say, oh, well, why do you have an education platform? I can rave about the education platform, but that's going to just bore them to tears. I'll go and say, well, the national average might surprise you that adherence rate to glaucoma medication is 36 to 50%. But the last survey that we did of our patients demonstrated that those being supported by Glaucoma Australia said theirs was 92%. So it's just a no-brainer for someone to send their patient to Glaucoma Australia so that we can help them save sight. Now, that is a much better answer, I would say, than tell them how great what we do is. People don't care what you do. They care what people receive, and they care that you are making a difference because of the service that you give. And so I try to frame everything on the results and why it's personal, rather than the busyness. People don't care. They assume you're busy. You should be busy.
And Pat and Trevor, you must also see that too. You must have some great stories about how to use your data to communicate empowering stories.
Well, what I go with this is that numbers, as Annie was saying, they tell the story. And lots of people actually make the mistake of assuming that everybody knows what their business is,
Mm.
who they serve, their community, and they'll just talk about it in generic terms. But once you start putting the numbers in the data, and to me, data isn't just numbers, data could be the stories, because it builds up a bigger picture. So if you're going to communicate an empowering story, and I heard what you said about sometimes people just look at graphs and go, oh no. But if you have comparisons, if you have images, it's like the professional speakers on stage, you can either bore somebody to death, or you can dress the data up and in sort of, like say the price of a cup of coffee for a year, that kind of thing. So you can actually dress it up in a story or in something that people associate themselves with. But yes, I see that when there's so many of the smaller charities are out there, say they've got volunteers visiting older people, for example, and there is such a lot of data that they could actually bring back, as you say, back to the organisation, but it's not captured.
And Trevor, did you have a story that's similar as well?
I'm sitting here nodding because I heard both Annie and now Patricia say about storytelling. Tell the stories. This is what happens. This is the outcomes we get. And I couldn't agree more with the storytelling aspect. Absolutely. Yeah. And
sorry, Trevor.
Also, too, being able to demonstrate those outcomes, as Annie was saying, is very, very important. And did you make a difference? That's one of my absolute hobby horses. With smaller local businesses trying to decide how they're going to support a local organisation or what they're going to do, what's going to make the most difference. And quite often it could be that not writing a check is not the best way to do it. It could be that involving their staff in working with the organisation. And at the most grassroots level, a Bunnings barbecue.
Yeah.
Send along 6 volunteers to a Bunnings barbecue.
Yeah.
And work your way up the tree from there. Yeah.
And as a marketing director, I'm not even going to get started on storytelling and connecting in a meaningful way and having data to back it up as well, but having those feelings. And in this industry, that's paramount, isn't it? So Christoph and perhaps Pat, can you tell me the top 3 ways that NFP clients can improve their data collection?
Patricia, do you want to start?
It's got to be top down as well as bottom up. It's got to be owned by the whole organisation. Otherwise, and as Annie says, she's a change CEO. So if you don't bring the people along with you, you could have those saboteurs along the way, and it really needs to be owned by everybody. That's my first one. Training.
Yeah, totally.
Definitely. Go on, Christoph.
Yeah, your point, I think Trevor made this conversation piece earlier. It's that if you collect data, it needs to be consistent throughout the business, right? We will find more often than not, people find ways around, and that becomes the second nature of the business. So, I kept this data here, and it may well be in something that they implemented during COVID that no one knew about, and then suddenly had been become a second part to the business, and yet the alternative business platform that they've been using for the last 10 years doesn't have any of this new data because you had to work from home. I couldn't access it. I kept it in a spreadsheet. I kept it in a Word document. I signed up to this platform. There's so many different ways that data can be kept, and it's that top down. Absolutely, Patricia. It's like, well, let's make sure that we understand what you're doing, where it's living, so that when we can then bring it back to somewhere, be it, central repository or somewhere that we can manage it and know that. Because again, to Annie's point earlier, there's a responsibility for the business, for the charity, for the NFP to know where their data and their supporters' data lives, so that they can keep that, governed, regulated, and know what the legal implications are.
Awesome. So going on from that, Christoph, what data might NFPs have hidden in their business already that can go a lot further?
Look, historical data is actually one of the most important things. I think Annie can probably talk to that as well, in the fact that, we found the historical data is probably sitting on someone's old PC, and more often than not, we don't know where it lives. And so someone's begs to ask the question 12 months, 18 months down the track, when there's a reporting requirement or there's a regulatory requirement, there's an audit requirement, and that where has that come from? And then suddenly someone turns around and goes, oh, you know, Helen used to look after that, and so it's on her PC. And I'm pretty sure that we've had this experience, Annie, in your business, where then you bring that and you understand that and bring that into a centralized repository.
So true. I have worked in so many businesses that all have secret squirrels, as I'll call them. And so that's it. It might be in their personal, their private folder or their SharePoint, or there's just data everywhere. No one knows what version it is. No one knows, if they got hit by a bus, where is it? How is it all sort of connected? And this fear that they have, what if someone sees my sheet or tampers with my data or this or that, whatever. And, and that's part of culture. It's actually giving them the confidence that we're not all working individually, we're working as a team, and a team approach requires appropriate visibilities of data and use and access, and then so that we're actually all contributing to that. We don't need to. So more and more I'm fine-tuning. I used to have so many different departments and files and bits and pieces, whereas actually once you start sort of getting a really clear strategy, you don't need as much, because more of the team should be working together on lots of documentations. And the biggest thing is, that's right, for me, it's just even version control. Oh my gosh, like that just does my head in. And there's so many different systems of it, and depends where people were trained and how they look at it. The concept that some have to open the document to see what the number is in the document, that is just mental. And so there's many, many levels of admin behind this data. And so I know many people listening in might go, oh yeah, I know this feeling, but I don't have the time. It's one of those things that I used to think that too. Like 5 years ago, I'd be going, oh gosh, it's not worth it. Whereas now I go, it is so worth the time. If you set up a great infrastructure that you know where everything is, who has access to it, how it's updated, where it's stored, and how I can glean that reports from that, that is golden. And you're going to be exponential in your service delivery. As Trevor was saying before, if you're holding certain information and it's just the way you've done it, sometimes once you become more efficient, you're just going to be able to get more done. And who doesn't want to do that? We all want to get more done in less time.
100%.
And calmer about it.
Can I just bring that point that you just made, Annie? Data strategy. I think that's the most important key conversation point. Every organization might have an information strategy, and I say that because we understand where information lives. It's the data strategy and the implementation of that, as you've experienced yourself, anyway. If you start to develop that, it becomes second nature, and the business can actually be self-fulfilling in regards to where the data lives and where it's stored, etc., and version control and contributions and who's touched it and whatnot. So yeah, the data strategy becomes what the business is operationally underpinned by eventually.
100%. And also there's tracking and accountability on that with any organization. Like as a CEO, that's right. If it's in the right place, if the data is stored in the right areas, then I get visibility of who did change that, who edited those documents. And that's really important, and it doesn't matter whether someone likes it or not. If you're being paid to be at work, then that is your organization's data, and we need to be really accountable for it. And also my job is to remove risk, who has access to delete data, to change data and so forth. So yeah, it's, we need to be really careful about our data security.
Pat?
Yeah, I just wanted to give you a quick one. I've been working with clients who have had something up to a dozen different systems in place, data collection systems. It's not been their fault. It's been the evolution of technology.
It's the legacy left behind, isn't it?
You'd probably see that in the small ones too, Trevor, right?
Oh, more so, Pat. Yeah, absolutely. And as simple as someone like myself, a sole trader with a consultancy business, I've still got a business card folder up there on that shelf. And I regularly refer to it, even though I've got a CRM system. I can go in and look up the person there. It's just easy to reach up now and then and grab that folder. And it's a reason to stand up from the desk, let's be honest. But you're right, absolutely. I couldn't agree more. Yep.
And look, the dependence on a CRM has become more and more important. The only thing that and I might refer to that conversation we had earlier, Rachel, about decoupling data. So when we talk about decoupling data, it's abstracting the data from the application. So a CRM is an application, but the data that lives in it is completely independent of that, and it should be. And so what we try to do is decouple pulling the application and the data as separate entities, because there may well be, and I think this will sort of speak to most charitable organisations and FPs, there may be a better platform that lives for what your intended service is than what you currently use. Now, if you're locked in, and we've seen this so many times, you get locked into a roadmap that's not particularly in line with your business strategy. Once you've decoupled that data, you can then make that independent decision to switch and move. And Annie, you've done that recently. We've spoken about this, Patricia, about how you help people with that. And I'm sure, Trevor, you've said that before, that, you know, that ability to take, for example, a business card, digitize it, and then add that to a platform that isn't necessarily, you know, locked in. It's the data that comes with that is so crucial. And then decoupling that then enables a business to be able to be flexible too.
So Christoph, I'm going to kick it straight back to basics for a second. We're talking a lot about data. What kind of data points, can you just rattle off a couple, might we be looking at for NFPs and charities that we might need to collect?
Look, it's that movement, and I think it's from sponsor to supporter is the term that we use, that we hear quite a lot. And I'm sure, not, you know, seeing everyone nod, it's that data point starts where your interaction with the community, and I say that it's not just charities or NFPs, but it's community, clubs, you know, all those sort of services that help. It's that understanding of that. Firstly, it's the quintessential. So the data that we're talking about, the data points are, what is it you do? Who is it that you serve? What does the profile of those people and the community and the clubs and the charitable organizations look like? And what is that you can then benchmark to show what your service is doing for them? And it could be just as simple as Annie's particular was around, you know, how do we engage with the people with eye health issues to move them along? So have they shown X, Y, and Z, you know, shown signs of any glaucoma or any eye health degradation? What does that look like? And so what are those key data points? And that could be, just for one example, and another example could be, Pat was talking about, you know, we've got a whole different Jewish community that are supporting a certain service, but they don't actually know who's being served by that. So the data points may not be to a demographic, may not be to a specific type that we currently serve, but knowing that and those touch points and being able to prove that makes a big difference to a business and a charity.
Awesome. So that's a really good segue again. Thank you, Christoph. For my next question, which Trevor and Pat, Trevor and Annie, how do you explain where the funds go and therefore prove your community connection?
Okay, so because I'm coming from the smaller end of the space, my experience has been that if you want to demonstrate that whether it be funds that people are donating or time they're giving, or whatever it might be, that it's making a difference, there's no such thing as too minute a detail to provide. Mm-hmm. And I'm talking about if you're funding medical research and giving out grants for medical research, get one of the researchers to speak to a room full of business people, potential donors, and explain to them that the money in the grant even paid for a dedicated phone line, because you can't be using a phone line in a hospital that's funded by the New South Wales government to run this research project. All those little, I'm sorry, what do they call those little finger prick things you do when you take a blood sample? Mm-hmm. You can only use those once, you've got to throw them away. And if you're doing a medical research project, you're using hundreds, possibly thousands of those little things. And they might only cost a fraction of a cent each, but you've got to fund all of that. So the more, don't be afraid to go down grassroots. I'm on the board of and involved with a small charity that provides assistance for families of kids with severe disabilities. And same again, what did you do with the money? Well, we actually repainted that kid's bedroom because it's more relevant from a sensory point of view for this kid with severe mental disabilities and so on. So yeah, the minutiae, it doesn't hurt, to be honest, about the minutiae. It's not all sexy and glamorous in those sort of situations.
Yeah.
Annie may have a completely different story. That's certainly been my experience. It doesn't have to be sexy and glamorous.
Hey, I'm all about being sexy and glamorous, Trevor. So we can go different camps there. I think for me, I used to be more nervous about, talking about the money. And I think we have to actually be really upfront about the money and not embarrassed about that, and communicate, well, what value people are giving. If they're donating, let's face it, for an eye health charity that I run, it's going to be bequest and then donation. So we have to be as our primary source. And then we all obviously want grants and other revenue sources as well. And so for me, that's right. If I've got a trust at the moment who want to give a certain amount towards children with glaucoma. So instead of me just going, okay, well, I've received this amount of money and that's great, I actually every year go and give them an update. Because of that money that you did, we were able to then start our own congenital glaucoma group, which on Facebook now, which has 300 members. They have met personally and then we've also been able to secure a top position to provide a webinar based on the questions that they've invited in that chat group. Well, that person who might have given that money once will just go, wow, I see the value. And of course, at the front of my marketing will be that child with their little glasses and their vision, whatever, not to upsell it, but to go, yeah, you helped that child. You helped that mum who had such anxiety about her child. You connected them to the top professionals in this country. And so that's a really great thing for someone who, exactly, we give out grants as well, which is amazing for a charity. So we give $200,000 of grants towards glaucoma research. And so that's the same thing. For those people who give to our research campaign, we put the face of the people doing the research. Here's this top researcher, Flora Hui from the Centre for Eye Research. She's doing this, using the money that you gave to see if vitamin B3 helps people with glaucoma. It's going to be, if it is, it's revolutionary because it's so low value, you can even buy it from the chemist. So we don't know if it's going to work or not, but hey, that's way better than eye surgery. Thank you so much. Let's cheer her on as she does her research. Well, she's like a rock star, right? Researcher, which is better than just being in a lab working out what vitamins are working with the back of your eyes. So with all of that, I think we actually go, please give me some funds. If you are going to use these funds, I will be able to tell you how to use them. We have to also have great integrity around that too, because for my organization, for example, we might have 50% who say, I want it to go to research or undisclosed. And so I have to be really true to that. I have to make sure that I manage those funds accordingly and not just use them for operations. People also like to know that you do amazing things, but hardly spend anything on operations, which is just hilarious. And so, rather than just sort of talk about, that how do I hide that huge part of wages, for example, or fundraising, it's more that, because you're investing in this area, this team is able to have, currently have 5 awareness campaigns that are finding people with glaucoma who are reducing their rate of preventable blindness, and that's exciting. Thanks for being part of that. So it's how we think about money coming into our organizations, and then the message that we share, rather than trying to be creative in our accounting, because that just makes you defensive. You should be leading by what you're doing.
Yeah. Can I just add here that this is actually a vital question for anybody actually working in the grant space, because you've got to prove at the end of it how you spent that money.
Yes.
And that's about the evaluation. That's about looking at the impacts, the social, the economic, the environmental, the cultural. And that's by collecting that data.
Yes.
Yeah. So Pat and Christoph, how should charities and entities use their data to secure funding for growth activities and growth activities?
That's one for you, Patricia.
Surprise, Christoph.
Hi.
I've actually got, I don't know whether people can see it, but I've got a hand. I tell people to talk.
See your hand,
Yeah, there's a hand. Doesn't need back reading it, but there's a hand. I always tell them to talk to the hand, because there's so much data that they can get. I mean, you've really got to be able to, as we mentioned earlier, never assume, even if you know that the funder knows you, that they know you. You've got to start from scratch. You've got to get out there. You've got to use your data, your demographic data, or anything, research data. So I've said external data is the thumb. Government policy plans or the philanthropic policies and plans, because there's data in that documentation. It's not about repeating the words. It's about getting to what their research and being able to to piggyback onto it, basically. There's research data. There's the own internal data, your success stories. That tends to be a little bit of the weakness for many, because they've not been very good at capturing that data. And then there's the what I call the evaluation and stakeholder feedback. So there's plenty of data that you can bring in. You just have to remember that you are talking to somebody who knows nothing about who you're trying to reach and who you are.
Yeah.
And where you are.
So Christoph, what are the costs involved with capturing and analysing data?
Good question, Rachel. Look, there's various ways that data can be captured, and the thought process that I think we addressed earlier was around the fact that certain platforms can be used. So the costs of hosting on that platform, the costs of storing, etc., are certainly something to consider. The reason I bring that to attention is because if you get caught in a roadmap or a locked-in platform, often those costs can escalate. And for an NFP, that can be, the difference between being able to serve and being able to put on a headcount for, marketing services, or even in being able to support that Bunnings sausage sizzle that Trevor's going to put on. And so it's understanding that data in those platforms, because then you can then look at decoupling. And I say that again, because once the data is yours, and as a charitable organization, NFP, etc., that data becomes your asset, and you can move that as you need it to find yourself a platform or a service that could be more effective or in line with what your business does at a slightly cheaper point, and then being able to use that return on investment so that you can actually serve the community better or increased operational efficiencies. So there's many ways that the ROI can turn around.
Nice.
So
Pat, sorry,
I was just going to add to that, that it's about thinking like a leader, right? We're all leaders if we're working in this space. And so it's actually saying, what do I want? If I get the crystal ball, what's the best way to actually store and manage my data and use that data? And what platform would that look like? And that's it. We often inherit platforms that might have been good in their time, or maybe we even got them and they were rubbish then, and that's where you feel stuck. And so once you're stuck, you're always trying to work with what you've got. Well, you're never going to do amazing things if you're stuck in this, with this noose around your neck. So it's actually about, that's right, decoupling. I love it, because it's saying, I want to have ownership. I want to be able to say, if I want to move it from here to here to here, if I want to use it in these ways, I can. And so it's actually saying, and particularly data is going to therefore be transient in this modern generation. You've got new systems getting launched all the time. And so I want to have a data system that it might only be here for 3 years and then I might move. It's a bit like moving house kind of thing. Well, I want to know that I can move to where I want to be for the best value of the business, not stuck around a system that was written, by tech heads for any industry. We are all special and we should own that, right? And so make it work for you.
Nice. So Pat, what advice would you give to anyone who says that there's already too much red tape without adding more costs and time?
Okay, I've first got to let you understand that I used to work in a government department in the funding area. So I've heard this argument so many times, but you have to justify the funding at the end of the day. It's the public purse in this case. But my advice is speak to another organization that has actually done it. Because it doesn't matter how much arguing you do with them, if they're in that mindset, they've got to see it themselves to believe it. And look, I can pick out a few examples where they've embedded that whole culture of data collection and it's taken them to a whole new level. And then that's your return on investment, it's your return on effort, and it's demonstrated.
Yeah.
I think we can definitely speak to that in what the charities and the NFPs, even the healthcare and aged care facilities that we support in that conversation, early conversation that we have at the onset around your data strategy has changed. And I say this with respect because we had this conversation, Annie, last year, for example, right? The ability for you to be a dynamic organization, even during COVID, and, that changed because the platforms that you used then are not what you use today, because you can now do that from anywhere, right? Your staff can be capable of being able to serve.
Absolutely. Yeah, we were completely stuck. That's it. We went to Christoph with this massive dilemma. We only had 2 licenses for a team of 6 because they were on the office, and when someone in the office wasn't using it, then they could share amongst themselves. Well, once COVID hit, like that's disaster. You know, we've got to work remote, but how do we actually do that? You know, and so it was an emergency. All of a sudden, we looked at different access levels, different, you know, even the systems that those staff members were keeping them on. You know, if you suddenly got laptops flinging here, there and everywhere, you know, what's the security on them and so forth. So, you know, I'm so thankful, Christoph, because you really, just really made it so much easier. And we're so happy. You know, it's always hard to change what you've got, even if you don't like it, right? It's the whole principles of change. But once you rip that Band-Aid off, you know, we've just skyrocketed because of that need, because we knew it wasn't right. And COVID actually, therefore, was that instigator to go, right, let's just fix it, and now it's really good.
It's that whole meme, and I say that we've seen that in the internet quite often. What was the leader in your digital transformation, the CEO, CTO, or COVID?
Yeah, absolutely. You're seeing that all over the place, aren't you?
There's frustration in COVID.
But this stretches to any business, and sort of that speaks to, you know, and I say that what we have tried to achieve with our partners, our customers, is that let's take that approach. Let's look at it at a holistic business level, not just look at it at an application or a specific need level, because now we're working differently. And if you think about the world that we live in today, it's not going to disappear immediately. And so we have that flexibility, and giving that to charitable organizations, especially now, because they're needed more than ever. You know, the charitable organizations out there today are so necessary. You know, there's mental health issues, there's increased health issues. So people are working from home, less exercise, you know, less focus on themselves. So what we're doing is to support that and then make sure that those communities are able to be served, because at the end of the day, that brings inspiration to what everyone does. I mean, everyone in this room is inspired by what we do because of that. And so for us, we try to support that and put the end client, so to speak, and supporter or sponsor first.
Can I also say too, going back to when we started this little bit of the conversation with Patricia, I'd argue that if the data collection process and capture process is done properly, there's probably going to be less red tape and less work, as you do it right once, and then you've got the data there to use to extrapolate, to cross-match, whatever you want, but collect it properly in the first instance. So in Trevor's case, don't put that business card up in that folder, actually store the thing in your CRM system, whatever it may be. So it looks like, I'm guessing, for some organizations, a lot more work, but in the end, it's once the system's in place, it's probably less work.
Yes.
So talking to those kind of systems in place, Trevor, I'd imagine you get questions around, you know, how much does that cost when we're talking about admin and things like that. So how do you address that as an NFP or a charity to, you know, almost justify it?
I think the worst thing you can do is try to dodge the question or sound like you're dodging the question. That's the number one sin, because instantly people's radar goes off and, you know, red flags go up in their brains, and potential donors and supporters all start thinking you're trying to be sneaky with them. Now, you don't have to tell them exactly what the CEO's salary is and all that sort of stuff as well. But there are ways around it. And look, the phrases that you use are going to be different depending on the situation of the organisation you're in. So my contribution to this little part of the discussion is, do not, and I don't think anyone in this room would think that it was a good idea, but don't for a moment try and dodge the question or fudge it. And you might be in a situation with your organisation where you're comfortable saying 5% of our funding goes into administration costs. That might be something you're comfortable with, and so on. Or it could be that, look, I've actually turned the conversation around and said, look, that's a really good question. Let's talk about what we actually do and just how much of that money goes out there. We collected this much last year and we gave away this much in grants. And the question about what the difference was sort of forgotten once they heard how much of it we got out in grants and so on. So, but yeah, trying to dodge the question is the worst thing you can do. Yeah.
So I'm just going to remind everyone here, this is our last question we're doing now. So audience, if you have any questions, please type them in the little chat box and we will address them at the end if we've got time. We've got 5 minutes currently. So Annie and Christoph, how do you use your data to guide future strategy?
I'm going to let Annie run that one.
I'm using my data at the moment to say if I've got a strategy now, which is, it's detect, defeat and sustain, pretty much we've got 3 key areas. I'm pointing down on the data that demonstrates that we're making a difference in those areas. So for example, if the detect category or strategy, there's 300,000 people with glaucoma in Australia, but 50% of them don't know it because of the way it affects it. So 50% of these people with this disease are potentially losing sight every day. And so we need to make sure that we are doing our awareness campaigns that drive testing. So a lot of people have awareness campaigns, but then what was the result? So you go, woohoo, we have a morning tea, we do things. But so data actually shows me, well, how many people went from that campaign? What's the analytics on how many people clicked on the website to book an optometrist appointment to get themselves tested? For those who went through that cycle, how many then came back? A percentage of them, will have glaucoma. So if they came from the so what is the return on that? So campaign cycles, what's the effectiveness of them? What's the value, for example, of, having Kirk Pengilly come on board? We've gone from a few 100,000 people seeing our campaigns to 12 million because of Kirk, because of his reach. And I get the analytics on that because I know the shows that he's on and how many people are watching those shows and so forth. So when I look at the analytics just in that area, or defeating, how much value we're adding because of the patient reported communications and surveys, and our sustainability, where that funding's coming from. On a high level, it's definitely going to be driving my future campaigns because I'm going to be analysing, okay, well, what is the value and where should we exploit that further? So for example, if Kirk came on board on his first year and did XYZ, oh my gosh, it was so exponential. We've now partnered with another company called Shopper Media, who then put him through 300 shopping centres throughout the country this year as well. It was amazing. And so who are our potential corporate partners? They might even be pro bono, or they might be of low value, good value for us. And so it's great because without that visibility, I will be flying blind. I'll just be saying we're trying to do our best. I've worked in those organizations before. We have, once a year, we have an awareness campaign and we hope everyone heard the message and we feel good about that. But at the end of the day, how do we demonstrate it? So I want to demonstrate it. And then I also want I want it to drive my future strategy. It'll drive how much emphasis. If I have 5 campaigns, do I put 20% effort in all of them? Maybe I put 80% in one because it's the key one, right? And then now, for example, I found that information. We have a campaign that launched very successfully called Treat Your Eyes. And so that's now going to drive our new annual fundraiser campaign, which will be a Treat Your Eyes fundraiser. And so that's massive in our future strategy because we've gone from one strategic area, which is detecting, to sustainability, if and when that fundraiser will be successful. So I'll say it's everything to drive your future strategy. It should be driving your future strategy.
And I'll add to that just briefly because I think Trevor's spoken this, and it's specifically what you do, Patricia, in that fact that, the data allows for that ability to actually focus. And it could be on one specific point, or it could be, in your case, Patricia, for example, going for those grants that will make a difference to you as a business to serve better.
I was just thinking about the effect of the data we put into it that actually underpins. I'm going right back to the strategic planning process because I've seen so many plans that have been done in a vacuum without actually collecting and analysing the data and doing the situation analysis and working. And when you've got a really good plan in place, you can use that actually when it comes to looking for funding, looking for grants, etc., because they can see that your strategy is based on a foundation.
Yep. And it's all underpinned by starting. And I think that's that conversation where I like to offer those out to our partners and to our FP charities, etc., organizations. We're happy to do that data strategy and come with you on that top-down approach, because it is, like Annie said, once you rip that Band-Aid off, I know it's painful at the beginning, but the results that you see 12 months in after that, twice, twofold, threefold ROI, I would say, if not more, maybe. Would you agree, Annie?
Yep, absolutely.
Awesome. And Christoph, if anyone listening on the call did want to investigate what they're doing, should they contact you?
Yeah, please, by all means, reach out to us. You know, there's various channels at ASE, contact sales@aseit.com.au. We're here to support definitely in the NFP and charities space so that we make sure that you guys are there to serve. And I'm really happy to give references and show to our communities out there that we're here to support them as well.
So this has been insane. Like, I have learned so much in the last hour. You guys are amazing. Thank you, Trevor. Thank you, Patricia. Thank you, Annie. Thank you, Christoph. That was awesome. So appreciate it. Appreciate your time. Appreciate your insights, and appreciate your experience in coming together to help other NFPs and charities to increase what they're doing in the future and to help more and more people. It's just such important work. And thank you so much, guys. And thanks to everyone that's watched.
Absolute pleasure.
Hopefully see you all again soon.
Thank you.
Thanks, everyone. Bye.
Bye-bye.